Good afternoon, everyone. So I'm going to talk to you about how to build a program Yoda style. I have no financial disclosures. In terms of my background, I initially trained at the Mayo Clinic in both multimodality cardiovascular imaging as well as heart disease in women. And then I got recruited to the University of Wisconsin to build a cardiac MR program. I also, during my time there, built a SCAT and a sarcoid program. And then about a year and a half ago, I got recruited back to Mayo. And in addition to all the other things I do, I'm working on building a cardiovascular disease in women's program, as well as a cardiac MR program at our health system. So I thought I'd talk about how I built my cardiac MR program, right, with MRI images, pulse sequences, physics, protons. Wait a second. I'm already seeing half of you guys kind of falling asleep. So that's not a good idea. So then I thought I'd in fact talk about how to build a women's heart disease program and the different things I went through. But again, I recognize, especially in this digital era where a lot of you have logged in, I have interventionalists, electrophysiologists, imagers, and so I need to find a common thread between the two programs that would also be applicable to you. And so I asked myself, what would Jedi Master Yoda say? And so using these principles and those that I have learned from my mentors over the last few years, I'm going to go through 10 Yoda principles that are applicable universally to building a program. Principle number 1, you must unlearn what you have learned. This refers to keeping an open mind. Relearning the needs and nuances of each institution is important. Although I was well trained at Mayo Clinic, I never went to UW, University of Wisconsin, and said, here's how we did it at Mayo, this is how it should be done. I first identified what the knowledge gaps or challenges were for each institution, and then adapted an answer accordingly to those challenges and opportunities available at that institution. Even though I had done a similar process at UW, I had to reinvent the wheel when I joined the health system practice to build their programs. Yoda principle number 2, wars not make one great. In other words, collaborate. My first collaboration with imaging was in the cards-reads collaboration between the cardiologist and the radiologist. Yoda talked about these principles 900 years ago in a galaxy far, far away. In a more contemporary era, in the Twitterverse, a wise woman said, find colleagues with similar interests and develop a team of people devoted to solving the same problem, although possibly from a different angle. I use this and have built a huge network of my ACC WIC sisters, only some of which are shown here. Yoda principle number 3, size matters not. In other words, start small. This is one of the most important principles. You need buy-in from both big and small. The big being people like chief of cardiology, your immediate boss, your administrators. The small being people that you work with, the teams, the RNs, the technologists, primary care providers, fellows. They're all your eyes and ears on the ground and will help support you. As my colleague, mentor, and friend, Annabelle Wogman said, promote on all community events. No event is too small. Go to book clubs, journal clubs, any community event where you can spread the word. Yoda principle number 4. All his life, he's looked away to the future, to the horizon, never his mind on where he was. In other words, be in the present. While it's good to keep an eye on the future, in my case, building a women's heart disease center, but don't do it at the cost of the present. Enjoy the journey to avoid burnout. Yoda principle number 5, believe in yourself. As Yoda was trying to teach Luke, he said, why you fail is because you don't believe. Believe in yourself. One of my good mentors and now friends, Jennifer Mirez, taught me avoid the imposter syndrome. She told me this about 2 years ago while I was debating whether or not to sign on editing a book on women's heart disease. I'm proud to say, thanks to her teaching, a year and a half later, I'm going to be editing a book on sex differences in cardiac diseases with my colleague, Melissa Wood, releasing February 1. Yoda principle number 6. No, try not. Do or do not. There is no try. Just do it. Be committed to what you're doing. And this will mean putting your best foot forward. There is no substitute for hard work. It will require some late nights. It will require reminding your colleagues of the value of your program. In my case, for cardiac MRI, when I first started, everybody wanted to just do echo imaging, and I gently kept reminding them, here's the value of the cardiac MRI. And closer to the end of my tenure, it was fascinating to see even the echo lab director would remember that and gradually start saying, oh, how about an MRI in this case, which is very rewarding to hear. Yoda principle number 7, younglings gather around. In other words, teach. The trainees can really help carry your torch forward. As I went on inpatient wards, I taught my trainees the value of cardiac MR and in which situations it would be helpful. And it was fascinating. A month or two later, when they would go on to other non-cardiology wards, they would often call me, or I would see a referral come by them because they had convinced their other attendings to order cardiac MRIs for certain situations. So make sure you teach. Yoda principle number 7, attachment leads to jealousy. Shadow of greed, that is. In other words, build your program for the right reasons, not for the fame or money or the title, but to advance the field, to help a patient. The rewards will follow. Yoda principle number 9, patience you must have, my young Padawan. In other words, be patient. Be patient with yourself and with your colleagues. Pace yourself. Program building does take time. Yoda principle number 10, difficult to see, always in motion is the future. In other words, anticipate change. Change is inevitable. There are going to be new guidelines and new data sets, telehealth, electronic medical records, and of course, the ultimate change, COVID-19, that we're all trying to figure out. Support your team and patients through this change. So we've just gone through the 10 Yoda principles of building a program. Unlearn what you've learned, collaborate, size matters not, focus on the present. You fail because you don't believe, avoid the imposter syndrome and believe in yourself. Do, don't try. Teach. Do it for the right reasons, avoid greed. Be patient. And finally, anticipate change. May the force be with you. Good luck as you try to build your programs. I'd be happy to take questions.